You're listening to On Shifting Ground from Commonwealth Club World Affairs and KQED. I'm Ray Suarez. During the first months of 2024, pundits believed third-party candidate Robert Kennedy Jr. could play spoiler in the presidential race. Back in the spring, while RFK Jr. was polling at only 10% of registered voters nationally, his political brand of skepticism and individualism was connecting with voters fed up with Biden's traditional Washington consensus policymaking. And after Kennedy dropped out of the race in August, the lifelong Democrat threw his weight behind Donald Trump. Before the election, Trump said Kennedy would have a big role in health care if he were reelected. And on November 14th, Trump announced RFK Jr. would be nominated to lead the Department of Health and Human Services. In the weeks since, more than 75 Nobel laureates have urged the U.S. Senate to deny Kennedy because they feel he would put the public's health in jeopardy. If confirmed, just how dangerous could Kennedy be at HHS? And how will his vaccine skepticism and alternative views on health affect policy? Keith Humphreys is the Esther Ting Memorial Professor in the Department of Psychiatry and Behavioral Sciences at Stanford University. His research addresses addictive disorders and the way science gets translated into public policy. He's published hundreds of papers in professional journals and in places where you're more likely to see his work, like The Atlantic and The Washington Post. Professor, welcome back to On Shifting Ground.
Always great to talk to you, Ray.
As you survey the horizon, infections that are percolating around the globe and in the United States, the team that's waiting to take the reins at the health apparatus in Washington, the track record of the once and future president, what should we be looking at? What should we be worried about?
Well, let me put in context just how important the health agencies are in the federal level. I think from the Cold War, we think of the big jobs are Secretary of State, Secretary of Defense, and the Attorney General. But the Secretary of Health actually commands a budget bigger than those three departments put together. It touches every time we put food in our mouth, or we drink water out of the tap, or we interact with a doctor or a nurse or the health insurance system. That agency is touching our lives. So it's extraordinarily consequential. And therefore, if there is bad policy, it has effects that we feel throughout the country. And I have two significant worries about specifically the person who's coming in, Robert Kennedy Jr., who has been nominated to be the health secretary. And the biggest one is that he is an anti-vaccine activist, and he has been for a very long time, and has said a number of things about vaccines that people who are experts in virology say are not true about particularly the risks of vaccines. And he's going to be probably the most powerful person in the world when it comes to vaccine policy. His department, if he's confirmed, oversees the funding, like what doctors get to do vaccines. CDC has programs that help people get vaccines. The Food and Drug Administration has advisory panels that say which vaccines should be approved and how, which could be stacked with other anti-vaccine advocates. And there's also the information most people get, not just in our country, but around the world, comes from CDC, which tells people what they are and what the risks and benefits are. That material could be changed. And there comes a point, as anyone who's an expert in infectious disease will tell you, if you have enough of the population not vaccinated, diseases that we thought we'd seen the back of, like measles, mumps, rubella, polio, can burst forth. And that is not going to just be a problem for us if that happens. It's a problem for the world because people travel. There is no such thing. There can't be a no peeing section of a swimming pool. And that's also true about infectious outbreaks.
When someone like Robert Kennedy is Secretary of Health and Human Services, as you say, if he's confirmed, that's symbolically potent. It sends a message around the United States. If you looked at it from Kennedy's point of view, the message would be, I'm willing to question orthodoxies. I'm willing to look at the science in new ways. I'm willing to shake things up. Is that, even by its very nature, problematic in this field of endeavor, in this particular field of endeavor.
Yeah, that's the way to say it, because certainly there are times when, shaking up the consensus has been very good for science. But in this case, no, because it is incontrovertible that vaccines are one of the biggest public health achievements of our lifetime and have saved millions and millions of lives. And you're right to say it isn't just the policy, it's the signal it sends. A lot of these decisions are made by state legislators, state medical boards, school board officials all over the country. And if he is legitimating the idea that vaccines are dangerous, vaccines should not be used, that's going to empower more of those people to take actions to reduce the vaccination in the domains that they have influence.
Kennedy has said right from the get-go that he's not a manager. He's a message guy, an advocate, a big picture guy. As such, if some really bad things start to happen, is it possible that the already established big machinery of America's public health infrastructure just kicks in as it's supposed to, the CDC at the NIH, and it won't really matter who at that moment is HHS secretary?
It's hard to know. I mean, Truman said about Ike, when he says when he becomes president, he's going to find out it's not like being a general. You're going to give an order and then nothing happens. And you'll say, wait a minute, I thought I was the boss. And there are many layers between a secretary and the person who, say, vaccinates a child in Atlanta or a senior citizen in Seattle. And those people will, be committed to doing their jobs. But in the end, there are political appointees at these agencies who are allowed to set policy. So they could constrain those employees enormously in what they do. So it depends a lot on who the people, as you go further down, who runs the CDC, who runs the FDA, and we don't know all those people yet.
The pandemic got politicized was a common refrain on both left and right during the worst times before the vaccine was widely available. During the pandemic, people believed or rejected public health messages based on the messenger. Are we about to rev that kind of tendency up again? You're a behaviorist. You're a guy who watches how people respond to big messages in the culture. What are some of the downsides of what could be coming?
Yeah, that was, if I look back at this, and I mean this in the colloquial sense, during COVID, we all went a little crazy. The emotion, fear, loss, I experienced this myself, anxiety, and with that, in that sort of ferment, strong beliefs, oftentimes strong irrational beliefs, spread throughout the population in bitter arguments, and frequently people opted for viewpoints that should have been evidence-derived, but were really derived through group membership. People like me, faithful conservatives, do not get a COVID vaccine. And we saw some prominent voices actually of that sort, like in the talk radio movement, died of COVID, some of whom before they died recanted their views, but they literally gave their lives for that type of thing. On the other hand, there can be some crossover potential. So if I could talk about someone else who is nominated to enter the HHS is Jay Bhattacharya, who I've been colleagues with at Stanford for 25 years. He's an ethical, intelligent, decent man who was pilloried during the COVID epidemic for his particular proposed approach to how to protect the
And remind people what that was.
Yeah, it was what he called focus protection. So Jay was critical of completely locking down society and instead said we should try to protect the most vulnerable groups like the elderly. And it doesn't matter whether you think he was right or wrong. It doesn't, to me, in the sense that he should have been critiqued based on, and a lot of the critique was about his character and his decency and his tone, which was completely unfair. And he could be a voice, having been through that fire, which I know was very painful, he could be a voice for, we need to not do that to each other. And he could be a credible voice, and he knows science very well. He's an excellent scientist, including for speaking for the value, for example, of vaccines, and maybe reach over across the partisan divide so we can start, doing things that maximize our health and well-being and not just fight with each other in ways that end up, as I see it, literally killing people.
I'm glad you used that technical term, we all went a little crazy, because when I think back to that time, there were eruptions of little distractions like hydroxychloroquine. And at a time when rigorous testing and door-stopping research was done and said, look, the conclusion was, this really doesn't do anything to stop COVID. People were so dug in, there came a point where people were so dug in that it didn't matter anymore that it was found to do nothing. Now, luckily, hydroxychloroquine is relatively benign, already widely used as a medicine for other uses, so it wasn't really that dangerous if people took it. But if you transfer that model, it almost felt like medicine shows in the 1880s with people selling elixirs off the back of wagons. Hydroxychloroquine did nothing to slow the spread of the COVID-19 pandemic, did nothing to reduce mortality, and yet today, circulating in the right-wing media ecosystem are hydroxychloroquine ads and sort of rebellious kind of give the man the finger kind of ad messages, still telling people to buy it to be ready for the next pandemic. Had you ever seen anything like this before during your years in the business?
No, I have not. And we could put in ivermectin in this discussion as well as another one that became a testament of faith. And, I think that is a good analogy of the old sort of patent medicine industry. But in some ways, to me, it's almost medieval, literally, in the sense of, during the plague, people believing that a certain prayer routine would stop them from getting the plague, or drinking the water from a particular well that had been blessed by a saint, because it did have almost a religious an identitarian aspect. That's what the thing was. If you were in the know, if you were in the group, you did this to the point of losing your life, because a lot of people who followed this advice did lose their life. And even when something was inert, if it stopped people from doing things that might have helped them avoid getting sick, in the thought that, well, that's always there on the shelf, then it did kill people. And we can't keep doing this. And we just can't. And, I am encouraged that Jay is one of the people to bring in. I hope that we'll bring in other people who can articulate the value of science. People have the credibility who are known willing to say things that are controversial, but in the end opt for evidence. That's what we want.
Are we so far down that alley of the politicization of threat and response that we're not going to come back from it that quickly, that we have to be sort of in a healing phase, a rebuilding phase of the public's faith in its own institutions for both monitoring, for being an early warning system, and also for advising a response?
I am afraid that we are really far down the rabbit hole of a fractured information ecosystem. So that you and I are talking to some audience of people, and there's somewhere else, some other show where two people are saying the exact opposite with a strong and passionate audience believing that. There doesn't seem to be a national platform anymore. It's not like Walter Cronkite or somebody who can summon us all together, after dinner at the same time and say, look, here's what's going on. The one person who can probably do that still in American life is the President of the United States. But of course, the President of the United States was one of the principal people who put these ideas out in the first place. So whether he can take a different role, I don't know. I wouldn't bet money on it. But if so, that is maybe the one place where that can still happen.
Can we be walking into something that is a lot more dangerous? H5N1 bird flu is in circulation. It's said to be widely spread in livestock herds. What is there that the CDC, the NIH, the Department of Health and Human Services should prudently do, not over or underreacting, in that tricky time as one administration hands off to another? It's still a couple of months till this new team is firmly in control. A lot can happen.
Yeah. I mean, here's just something simple and horrible. Let's say the COVID virus goes through another round of mutations, completely evades the vaccines we have, and becomes more deadly. That's entirely plausible. There's no reason that can't happen. what would we do in that situation? It would be disastrous. So it's sort of in the same way the financial crisis that happened right when President Bush was, in his lame duck and President Obama hadn't taken over. They actually did as well as you probably could do trying to get that to work, but it's still tremendously hard. And back then, that was 15 years ago, of course, the parties trusted each other a lot more. People were demonizing as much more. So if that happens, I think we'd be extraordinarily vulnerable.
California is an interesting laboratory for vaccine skepticism because I think it could be argued that a lot of the impulse for, let's say, loosening the restrictions, loosening the controls, came originally from the left and then sort of migrated to the right. So you had people in very well-educated, very affluent counties wanting their own children to skip what had been mandatory vaccines. And that fashion moved, it morphed, and became something more widely distributed to the point where there were mini epidemics popping up in places like Disneyland. Has California taught us some useful lessons about how to split the difference on some of these things, respect the idea of parental control, but also recognize that below certain threshold levels of vaccination, they become less effective and diseases become more dangerous?
Yeah, I mean, there's a horseshoe with the kind of libertarian understanding of lots of things. I mean, the same kind of thing you might see with psychedelic drugs. Psychedelic drugs have a following on the very left, and there's some people on the very right they'd use different language, but they would say, it's being kept from us, the healing power of these, you can't trust what the government says, and all that sort of thing. It's very hard to negotiate with that because it really tends to be based on a complete distrust in any outside source of information. So how do you, if you're someone like me who is a scientist who tries to be responsible and say, here's what we know, by definition, if I am not credible with either of those groups, or CDC is not credible, or the governor of California is not credible, it's really tough to cut through that. I don't have any clever solution to that. And the ability of groups, particularly in the online world, to maintain that independent culture is much more easy than it ever used to be. So my sort of maxim about the internet is every village has always had its idiot, but they didn't know each other personally until we got the internet.
Yeah, really. They can now find each other much more effectively. That idea of maverick notions, we discussed it earlier, but I want to return to Robert Kennedy because he has said some things that if he was just a sort of freelance bomb thrower, you might say, well, that's all right. It's a bit of grit in the national conversation. That's fine. If he is in a late night bull session and says the COVID-19 virus has been engineered not to infect Ashkenazi Jews and Chinese, really, what's the harm? If down the road he says, well, yeah, I got some bad information, and we move on, what's the harm? Is it really a problem having a guy in the big office who takes that approach?
Yeah, I think it is, if he stays that way. I mean, one of the things about that role is that the costs of it are nil when it's not going to be turned into policy. You don't have to live with the responsibility and the effects. There's sometimes when people get in a role where now your shot from the hip remark is going to be turned into something real, and you will have to deal with it and be held responsible for it, they change. And whether he is of that type, I have no idea. I've never met the man. But, in fairness to people who felt alienated from public health consensus, when we shut down schools, there were people who said this would do some harm to kids, who were really shouted down and said, you can't say that. But it turned out to be true. Kids, had a lot of learning loss. We might have said we were going to do it anyway. It was worth it, but we should have at least weighed the cost to kids. Something Jay Bhattacharya said was that when you shut down the American economy, it has adverse effects in developing countries all around the world. That is true. We might still have done it, but it was at least a cost we should have discussed. And if we being everybody who works in public health, had been at least open on the reasonable skepticism questions, I think that would have given us more legitimacy when we got to things that truly were unreasonable, like quack cures and things like that.
Well, we may have other pandemics looming in the future. If you've got Robert Kennedy in The Big Job and Jay Bhattacharya, help me understand the difference between being a raw milk advocate, which is kind of a fringy but persistent flex in a lot of American communities, as Robert Kennedy is, and Jay Bhattacharya's idea that we should take a different approach to the institutions in society where we curtail or lock down human contact. They're in charge. They've got the big jobs. The next disease comes. What's the difference between advocating a kind of fringe position that we can debate and small numbers of people will take the risk onto themselves and they'll get sick or not get sick and life will go on, versus sort of very highly scaled approaches to public health that we're talking about in the case of Dr. Bhattacharya?
Yeah. Jay is a trained scientist. Robert F. Kennedy is not. And that's a big difference where you look to for your authority. So when someone can say, well, I'm saying this because I see different countries have done different things, say around COVID, and I can see these consequences in that data, that's a different source of authority than, look, I heard it on the internet, you can't believe what you're hearing, and I heard this really powerful anecdote, that kind of stuff we should be more skeptical of because we all can be seduced by those things, but they aren't often true. I mean, they're often untrue. They feel true, but they aren't actually factually true. So I think that's one part of it. And then the other part, the source where you end up saying this is the ultimate authority, is how consequential is the decision, and for how many people are affected. So if it's something like you want to do some weird exercise that might hurt your back, someone can say, well, that's maybe inadvisable, but that's really, in the end, the person who's going to suffer if it does hurt your back is you, versus something like you don't really need to get your kid a measles shot. That really isn't just about a decision about your kid. That's a decision about every kid. It's about a decision for every newborn, since they can't be vaccinated, whether their parents can go outside of the house or not. That's a decision for every, that'll affect every kid in the classroom. And for those kinds of decisions, I think we have a responsibility to impose a high standard of evidence, because it's not just about it feels true. It's about all of us, the obligations we have to each other.
Human experience comes in as an important and potent factor in these questions. I lost all my overtime is real. My place where I work cut back a whole shift is real. I had to work from home and it was really bad for me is real. But so is I took ivermectin and I didn't get COVID. Or I drink raw milk all the time and look at me, I'm fine. Human experience and human trial and error ends up sending potent messages into our decision-making around these things.
Yeah, and we can't ignore that. And I mean that in the sense of like we are literally incapable of ignoring our own experience. It's virtually impossible. But what we can do, and I feel like what a lot of education can do, is also help us understand like what inferences we can draw from it. So I drank raw milk and I didn't get COVID. That's your experience. It's true. But it doesn't necessarily support the inference that raw milk prevents COVID, and therefore everyone else should be drinking raw milk. Because it could best be a coincidence that, these two things happen. I feel like that is a role for good education and also the leaders we have to help us not to dishonor our personal experience, but just to say you have to put it in a framework and still be analytic about it and not just draw huge conclusions about something that happened to you that could be coincidental, fortuitous, serendipity.
But huge conclusions is where it gets tricky, because I lost all my overtime leaves you a little short at the end of the month, may leave you steaming and unhappy. And the 35,000-foot view across a whole state or a whole region that concludes that 1,100 fewer people died because we curtailed economic activity. 10,000 fewer infections because we closed these places where people congregate and breathe on each other. Yeah, but I couldn't pay my car note. And that's two different levels of analysis.
Yeah, and they're both true. They're both true. And we could go through a million other things. People, I wanted to sing in my choir in church and they wouldn't let me. I wanted to see my mother was dying and I wanted to hold her hand as she died and they wouldn't let me. And those are real experiences and those were real costs of our policy. And I think all you can do as a leader is say, you're right. That is a big cost and you're upset, you're hurt, you're grieving. Of course you are. And that is true. And it is also true that horrible policy is something we had to do to save thousands and thousands of lives. And those lives also have value. And those are the choices we make together in a democracy. I think the best thing we do is be candid about that. That was, I think, a mistake during COVID. In some sense was to shut down people who wanted to say, but I lost my job, or I wanted to hold my mother's hands. And sort of saying, well, the science says that doesn't matter. Well, come on, it matters. And we should have let that conversation run.
I couldn't agree with you more, but I also think that I was left by the whole experience with the idea that sometimes it looked like we didn't care about each other very much. The argument that we were saving the lives and preventing serious illness among people we didn't know just didn't seem to land, and that felt a little scary, frankly.
Yeah, no, there was a real breakdown of the sort of the sense of unum during COVID, which may have also partly been because we were scared. I was scared. It was a frightening illness. We didn't understand it. I was pleasantly shocked we developed a vaccine that quickly. There's plenty of other diseases we've never been able to do that, and I wondered, is this going to be our life from now on? So I appreciate that. And fear can affect us in different ways. Sometimes it pulls us together. Other times it drives us apart as we start worrying about our individual level survival. There was a lot of that. There was a lack of compassion for people whose lives were really different. If you were in the laptop class, as I am, it was a different experience for me of I could order my food and have someone bring me my food to my office, which was my home. But that person is out there. Right? And so their life is different than mine. And that also broke down a lot, that sort of sense of just connection across different classes of people. And that is something, I feel we should be embarrassed about that, ashamed of that. We should have done a better job doing right by a broader range of people.
Are you worried that we're not ready for the next one?
Oh, God, we're not ready. We're not ready. I have a friend who's a military historian who said America prepares for war usually 1 to 2 years after the war starts. And that has been the experience around infectious disease outbreaks, that we frequently are not ready, the world is not ready, and we respond too slowly. You can find some exceptions to that in our history, but they stand out because they are the exceptions. And if this starts again tomorrow with some new virus, I have a feeling it's going to be very bad.
That's Keith Humphreys. He is a professor in the Department of Psychiatry and Behavioral Sciences at Stanford University. Great to talk to you.
Great to talk to you too, Ray. Take care.
You've been listening to On Shifting Ground, produced in partnership with KQED, with funding from listeners like you. Today's episode was mixed and mastered by Matteo Schimpf. KQED's Jim Bennett is our technical supervisor. Jared Spord is our executive producer. Philip Yun is co-CEO of Commonwealth Club World Affairs. Our music is from Blue Dot Sessions. I'm Ray Suarez. Thanks for listening.